Hello everybody and welcome to your CPE400. This final clinical will require 200 hours, and this is where you will integrate the theory from all courses into the role of a practical nurse in acute care setting and other practice areas as appropriate. At the end of this clinical, students will learn to practice within relevant legislation, the entry level for licensed practical nurses, understand the definition of consent, develop critical thinking, apply the nursing process and consistent client-specific decision-making skills with collaborative approach, effective communication, identifying own values, and participate in continuous learning to maintain competence. These are your assignments for this clinical. Starting with the site orientation on your first day. This is where you need to be familiar with the practice setting. Know the policies, health and safety regulations, emergency responses, tour the site, be familiar with the site's local areas and your care floor areas, understand the daily routine, and follow your instructor for any new information within the site. After completing this assignment, you and your instructor will sign the form and students will upload this on Moodle. Next is the weekly reflective journal, which is a total of 1 to 2 pages and double-spaced using the ORID model. When creating your journal, just always make sure that you are keeping your residents' or your patient's confidentiality by only placing their initial in your assignments. In your journal, you can talk about the things that you have learned, what things you remember, what you observed, any improvements from your skills. Did you have any emotions during your shift? And you can share any self-reflection about your experience during that week. Your instructor will also let you know when the deadline is every week, and you will upload this on Moodle for marking. Next is a learning activity where you will be able to define and describe your client's diagnosis, signs and symptoms, labs, and medications. Answer the following questions and provide a written research on this report and present it to your instructor. For concept mapping and nursing care plan, you will research on your client's conditions, medications, and other treatment regimens and will formulate care plans to assess, identify goals and potential problems, plan, implement, and evaluate interventions that will assist in meeting the client's holistic needs. Please follow the deadlines and the instructions by your instructor whenever you are submitting your concept mapping and care plans. For the leadership assignment, you will be presenting this in front of your peers. You will select a health issue that you have identified in your concept mapping and nursing care plan assignment and deliver a teaching plan during post-conference. This presentation should be no longer than 20 minutes. Your instructor will schedule you to present in week 3 and in week 4. By this clinical, you are already familiar with the self-assessment. You will add 3 comments for every competency, rate yourself, and fill out the reflection at the bottom. Your instructor will also provide you with feedback on these competencies. Both your midterm evaluation and the final evaluation will be a collaborative work between you and your instructor. Make sure they follow the deadlines that they have set and you can upload this on Moodle. Once everything is uploaded on Moodle, you will be graded for the final mastery once everything is complete and you have met all the competencies in this clinical. After that, you can move on to the CPE400. If evaluated by the instructor that the student needs further support, a learning plan can be assigned for the student to complete and to submit on Moodle. For medication errors, a medication safety learning document must be completed. We will now go over our guidelines and policies. Your clinical instructor will be with you for any support, or you can also email the clinical practice team if your instructor is not available. Your clinical instructor will evaluate your final grade in this clinical, and for you to get a mastery, this is based on participation, completion of assignments, meeting the competencies, and meeting the attendance expectations. As a student, you are responsible to introduce yourself to all the staff members whenever you have a chance, and ensure that you're wearing your ID at all times as well as your Stenberg scrubs. You have to complete your assignments, participate in clinical, and if there are any concerns, please ensure to communicate clearly with your clinical instructor. And if your clinical instructor is not available, once again, you can always communicate with the clinical practice manager. During clinical, we expect the students to comply with the site's safety rules and regulations. Always follow the site's safety incident reporting and policies and procedure. Always communicate with your instructor for any questions or concerns. Once again, IDs must be worn every shift with your Stenberg scrubs or light-colored scrubs. It must be tidy and odor or fragrant-free. Shoes must be worn closed toes, no sweaters over scrubs, but long sleeves underneath are permitted. Please see the dress policy in your student handbook for more details. In any group clinical, students can have one allowable absence. If you miss more than once, you may be at risk for not meeting the competency for attendance and may not receive a mastery. In preceptorship, there is no allowable absence. Each of the following examples will be considered absence if, number 1, if you leave early or arrive late for over 2 hours. Number 2, if you are late or leave early twice than the scheduled start time and end time. And number 3, not following the proper call-in procedure. Any absence due to a medical reason, a doctor's note will be required prior to returning, stating that the student is emotionally or physically fit to return to clinical. This wraps up our clinical prep for CPE400. We are so excited for you to apply all the things that you have learned throughout the program. Have a great clinical experience, and we wish you all the best.